Hey, everybody, this is the Wellman's podcast. I'm really excited here today for a number of reasons. First of all, my co-host, Brian Brosey, he should now be referred to Dr. Brosey. Just graduated from PT school. He's now a professional. So Dr. Brian Brosey, congrats, man.
Thanks, Keoni. I'll work in some claps. I'll add some fake claps, some Oscar claps.
Yeah. And now we have a veteran PT also with us again, Dr. Sarvar Pathan. I'm really excited to have him here. Him and his wife have really helped out my business with referrals for some complaints where, I just kind of throw my hands up in the air. So I love having my co-host as a doctor of PT, and then Dr. Sarvar, who's here that, in the area, that has helped me, and his wife helped me tremendously. Anyway, just a little bit about Dr. Pathan. He's the founder and owner of Personalized Physical Therapy and Wellness, and the creator of Healthy, Wealthy, Winston-Salem podcasts. He's serving basically the Piedmont area here in North Carolina, High Point, Greensboro, Winston-Salem, where I am. To reach him, his website is www.pptaw.com. Please reach out to him for any advice on anything. He's my go-to doctor expert, him and Brian. He is really a wonderful back pain expert, has over 8 years of clinical experience treating back pain. He also does a number of other things, as most PTs do, with joints, but he's our back pain expert here in the Triad. He is a clinical supervisor at Wake Forest High Point Medical Center and is taught at High Point University. And welcome, Dr. Pathan. Thank you for being here.
Well, that is a very humbling introduction. Thank you very much for having me. And I should say, Dr. Brosey, congratulations to you also with the doctor hat put on. So here are the claps from the background for you.
Thank you.
Well, I'm so glad to have you back on, because right now, Dr. Brosey is in the midst of going to work and trying to go to work, and you are a veteran doctor of PT. So maybe you can give us some hints, or give Brian some hints on how to go about doing that. And I guess we just want to start off with is how you started off with your practice.
Yeah, absolutely. And yes, it is a very unusual time right now. COVID-19, we're, in the middle of basically a pandemic that we have, at least in our lifetime, never experienced, nor our patients that we currently treat have experienced. We started our practice in 2018. We have a mobile physical therapy practice that we serve the patients in their own environment, be in their own home, their office, at the time when the gyms were open, in the gym, or at our office location. And so we basically make sure that we're taking appropriate precautions in the midst of the COVID-19 while we're providing the one-on-one personalized care. Turns out to be it's much more safer, individualized, personalized, while it being high quality and premium services that we provide. We specialize with musculoskeletal conditions. That is something that I hold the fort for. And my wife, Farheen Pathan, she specializes with women's health conditions and has a niche with pelvic floor, urinary incontinence, prolapse, all of the conditions that is sort of stigmatized and even not discussed much in even a gynecologist visit. Let's say pain during intercourse or discomfort while they are just going about their normal exercise routine, where they may not be able to control their urination and all that. So all of those specialties is what our current services provide. And we've been serving the county in general, and we've expanded our niche from the last time when I was here to a few other, which is including like 4 other counties around the Guilford, the Davie, the Advance area.
Oh, great.
Yep. And so it's been good overall.
Yeah. A shout out to your wife. She's done incredible work for my patients. I just want to bring that up. I mean, it is interesting because a lot of my patients, they'll bring up things like, prolapse or, urinary incontinence, maybe bowel incontinence, where the pelvic floor is just really weak. And it's always like, okay, I know who you have to see. And they never hear anything about it from from their physicians or anything about that. It's just like, okay, well, you just kind of have to live with it. So she's really been a godsend for a lot of my patients, as well as you, but especially for that, because it's not really talked about a lot, and it is kind of stigmatized.
That is. And there's a practitioner that we connect with in High Point. And the very first time he's been practicing, he's a nurse practitioner with all the major hospital systems. He's been practicing over 25 years. And to him, as a nurse practitioner, when he would have a conversation with the potential patients that he would bring on with the practice or with the hospital, that would be just a check off. Do you have it or you don't? And
Right.
if you have it, well, okay, you got it because you've gotten to the point of having it, and that's just a norm. And
Right.
don't have it, okay, well, you eventually will have it, and that's okay. And 5 minutes of conversations that they both had, and he was just his eyes wide open and awestruck, and he was thinking, so that is not normal. Is that what you're saying? And for him was also shocked to learn that 25 years into nursing practice, and that's what the general understanding is. And I'm not blaming the individual, but I'm blaming the system.
Right.
That the whole stigmatized nature of pelvic floor conditions is not talked about, and that's how it's being interpreted. And the patients then think, well, having urinary incontinence is normal. And similarly in musculoskeletal conditions also, like if I'm 50, well, what I'm going to do when I'm 50, supposedly it's okay to have back pain. I'm bound to have lower strength, or I'm bound to have radiating symptoms down the leg because my dad had it. So it might be hereditary. Who knows?
Yeah.
So on.
Well, you can just
it
imagine
is
the business
interesting.
model and how much more comfortable that is for someone, whether it be women's health or post-COVID, someone showing up to your location where it's safe or you've been there versus going into a healthcare facility today, both with women's health and post-COVID. So that concierge practice has to be phenomenal for people and their comfort levels right now.
Correct. Yes, it's much more personalized. It's safe, and then on top of that, we make sure that we take the appropriate precautions, putting on masks, doing gloves, cleaning, wiping, tables before and after, which we were doing with the wipes, but obviously the mask and the gloves are like the next level. Yeah.
Yeah, at our clinic, we've been taking it to the next level with all that too, with everything. But so as far as like, you guys are actually going into people's homes, right? And I guess they'd probably feel a lot more comfortable with that, instead of actually going to, non-essential medical services at a big clinic or somewhere, right?
That's right.
So
That's absolutely correct.
Who wants to wait in line, especially at a healthcare facility now?
Well, yeah, that's true. Yeah. You brought up something, and this is something I heard my whole life growing up, from my father, who suffered from back pain. Wait till you get to my age and you're just going to have all these aches and complaints. I mean, it's just a fact of life. So basically he was aging me before I even hit 30. Now I'm close to 50, and, you can have a life beyond 30 without a bunch of aches and pains. And this is one of the reasons why I'm, thrilled that one of my best friends is a doctor of PT, you Brian, Dr. Brosey, and having you on, Dr. Pathan. But can you speak to that a little bit? Because the general treatment is, if you have little aches and pains, most people just run down to the drugstore to begin with and pop their pain pill. And if it goes away, all is good. But they're not really getting to the root of the problem, and eventually it comes back, and then they go see a doctor, and then it seems like their treatment of choice is, if it keeps getting worse, is steroids or surgery.
Right.
And they seem to skip over you guys.
Right, right. In big scheme of things, it all comes down to education and the transfer of education that sets in from the beginning ongoing. So just in your example of your dad having an experience of back pain, educating you about this is how 50s look like.
Mm-hmm.
And now your ingrained sense would be, okay, well, that's a normal understanding. However, now it is a very true education because that's his personal experience.
Right.
However, if that personal experience would have been modified in whatever respect, then the passing on of the information would have been different. And so that's where the information age that we have right now in our responsibility is to pass on the ideal, the right amount, the right set of information that is correct for the independent age population. And it's statistically known that everyone goes through an experience of back pain. Like, if I'm also speaking statistically, over 80% of the people experience back pain at some point in their life. And having that experience, they start to go back to the past connections that they may have had with their families, because that's the closest of the connection. Now, when they had the condition, what kind of condition it is and how it evolves, as now we know with all the research and studies, that this particular condition, let's say a herniated disc, yes, naturally also resolves in about 25 to 30 days because it's a healing response. The body is going to respond to heal whatever the irritation was caused by, be it bending over and picking object or just sneezing really hard. And the body is going to try to heal it. However, it will only heal until the acute nature of pain is gone. And what really caused the pain, which was not having the right amount of tone around the muscles or not having the right position or the posture, all of those still persist.
Yeah.
And so the condition will come back because the cause wasn't fixed ahead of time. And who is to blame is, again, the system, because at the time, let's say the 25-day period when the pain was there, if he wasn't informed that this is the cause, he's only going to try to treat the symptom, and the symptom is pain. So comes the pain pill, and comes the steroid injection, and comes the surgery. However, the cause still persists and the pain still recurs.
Mm-hmm. Yeah, and that's a lot of people go through the most invasive part of like going through back surgery. A lot of them, they come out of that surgery and they still have the pain. And it's unfortunate to be subjected to that when you can at least try most of the non-invasive approach first, and the people that are the experts in back pain, you guys, before even getting to that point. I mean, it just seems like it would cancel out a lot of misery and suffering.
Absolutely.
Yeah. Anyway, as far as this whole COVID thing, what other precautions are you taking, and do you have any recommendations you give to your patients before you actually go into somebody's home with this? And what are their concerns?
Yeah, so most often than not, the immediate concerns that they have is, how do you, at this time, interact with the patients and have this one-on-one examination? And we'll just go and explain to them the precautions that I had mentioned to you just before, having gloves and mask and all of that. However, we also give them the option for them to choose how they prefer to have their session. Either that they would want to come to our facility, or that we come to them. Most often than not, the safest of the options that the people select is us going to them.
Yep.
And then with the addition of the telewell service, which is a telehealth, telemedicine service that we've done to our practice at the stroke of COVID-19, starting the 1st of April, that we have been working on, that we've been seeing patients through the digital service like how we are on a secure video call, and we walk them through the observation of what's going on. Let's say if it was back pain, what I see is the best set of tools that a physical therapist has is their set of eyes, and being able to see what's going on. And if there is a need for some hands-on or some external pressure, will also involve their caregivers and educate them as to how they can position their hand or the type of feeling that we would be looking for, or an application of a glide, and just being very safe and careful. And in cases when they're not safe, just being an assistance right beside them for delivering that hands-on experience. And it's been successful. I will say the telehealth service has been potentially the game changer for us in the COVID-19 times, because there is always going to be the need. People are having the discomfort, and with COVID-19, it's only gotten worse because the average sitting time that people were sitting during the day was 10 hours, and it went up to 13 to 14 hours. So the sedentary nature increased, and the pain is going to be there, and we need to be the steerheaders for making sure that we are available for them however possible. And so that's how we've been making sure that people stay healthy and strong around this COVID-19 also.
So with that being said, I mean, you can basically see people, anybody listening to this podcast can call you and use that service that you have.
Correct. We are licensed in the state of North Carolina. And so state of North Carolina, anybody can access our services. If it was for wellness services, which is part of our business practice also, that allows us to see anyone basically around the world.
Yeah, it's great.
It just goes back to education being the most important part, the key missing factor, because you can still provide that education in this Zoom format or whatever the format is online and provide the same level of skilled care that way.
Correct. Absolutely.
Dr. Pathan, can you talk a little bit about like what made you want to set up your practice the way it is instead of being in more of a stereotypical clinical practice?
Absolutely. Well, I should start from what my background is and how it evolved altogether. And I was, a practitioner at High Point Medical Center, and not trying to say anything negative about the practice, but the way how the interactions currently are happening between a physical therapist and a patient in just the general systems right now, that patients didn't really get the answers that they needed, or that they had struggled with getting the right quality of service for the appropriate amount of time that they needed. And that was a struggle between my ethical practice of what I wanted to do for them versus what I was told to do for them. And when I took that to the upper, management, it was looked upon as, well, that is how it is. And, you're asking to try to, change the system. Well, I wasn't trying to change the system that was present, but I was trying to help the patients that are in front of me. And so that allowed us to look into what is more possible for continuing to provide the premium level of service that the patients deserve and the patients are in the need of, how they can continue to work in the same cause that they have been created the issue with, and how they can resolve it all together and prevent it from coming back. Because what I also saw, that after 2-3 weeks or months of working with me, 6 months later, they would be back again with a similar issue. Well, we had given them the exercises, and yes, they potentially life came about and they couldn't stick to it. But it would have been much easier if there was an ongoing wellness or maintenance reminders or check-ins that I also tried to implement in my previous practice, which never really happened. And so that maintenance, that wellness, that allows us with the practice that we have to make sure that it never comes back to their life. We almost can look at someone and say, okay, these are the potential injury areas. Why don't we fix that so we don't have to deal with these injuries, and let's make sure that we are recurring that preventive model.
You know, it's funny because part of the reason why I do my practice the way that you do, it's kind of like I'm on my own. I carry my medical license in Washington State. I'm actually practicing in an unlicensed state as a physician. I'm licensed here as an acupuncturist. But the point of me going out on my own, and from what I hear from you, is basically, you know, if you're in a big practice like that, the art of medicine is non-existent anymore. You have to follow kind of like a protocol. And if you don't follow that protocol, that may not necessarily be what's best for the patient. So one of the reasons why I really love like people like you is because it's like, the art of medicine is there. It's not protocol based. You know, it's not like, okay, you have back pain, you diagnose as back pain. Okay, what do we give? Okay, we give this pain pill. Or you have high blood pressure, we give this pain pill. Like there's anybody can go to 4 years of medical school and learn that protocol. And that's kind of what it is. And I hear this from my MD friends also. They just feel like they have their hands tied in a big system like that. And I try to explain this to my patients, like if you can find somebody that's kind of allowed to bring the art of medicine back into the science of medicine, you're going to get, you know, one hell of a practitioner there that can really help you.
Absolutely. And that's where also we stand true with the fact that you guys are here in Winston-Salem and allows us to inform our patients that well and true, there is no red tapes and there are no red boundaries when you walk into Naturopathic Health Clinic of North Carolina, and will be taken care of. And so thanks for serving the community here also. Yeah, no,
I mean, I love being here, and it makes your practice much more enjoyable. You know, when you're able to have your own autonomy and do what you want to do and see what's best for the patient. I just feel like you can follow up with them better too. So,
I mean, it even goes to the name of your practice, Dr. Pathan. It's personalized physical therapy. Do you want physical therapy services, which you can get from any physical therapist, or is it personalized to you? And same with your practice, Keoni.
Yeah.
I mean, anyone can go anywhere and get X service. It's just to what degree is that service customized to your needs?
Well, it you know, somebody comes into me with back pain, you know, as opposed to going into their primary care physician, MD, you know, I'm going to be able, I just feel like I have the tools to be like, okay, you know, I know Dr. Pathan, this is what his focus is. Go here before you go the conventional route. Mm-hmm. I know Dr. Fahim Pathan. I mean, you know, go here for the pelvic floor dysfunction or whatever that may be before you go and get on, you know, the latest and greatest drug that helps you with, I don't know, urinary incontinence and that type of thing. Or do both. And at least, you know, with Dr. Pathan, you're getting to the root cause, and they'll be able to direct you to see if, you know, you need a more invasive approach. So yeah, absolutely. So when I tell my patients about you guys, Dr. Pathan, it's they're really thrilled because they feel like they're at a loss. You know, it's like they go to their urologist or whatever, and it's like, we'll try this pill, and that's the extent of it. Unfortunately, and that's the nature of our healthcare system. It's not a wellness system, as we're all hitting on.
Yeah.
And there's a financial incentive to keep it that way, you know, instead of really getting people out of that. Anyway, so where do you see yourself going from here, Dr. Pathan? Because I think a lot of this may help me, and then also with Dr. Brozy, who's just starting out.
Yeah, give me the blueprint, please.
Absolutely. Well, I'm more than happy to help if you need Brian for anything in general, you know, practice oriented or even in clinical related. I might have to contact you for the latest and greatest because you're just coming out. Yeah, and we are like the dinosaur knowledge that is just brewing to help patients, but you're coming out with evidence-based practice. So thank you for serving the community like how you do through your ways and through digital ways. So excellent. However, yeah, so basically what we would like and we are after is providing this mobile physical therapy and personalized wellness services basically for the whole state of North Carolina. We are slowly and steadily allowing ourselves to help individuals in and around our areas, but our goal is to be able to serve the whole state of North Carolina. We think that the people of our state deserve the higher quality of care. The state in itself has had more challenges health oriented than other states, and I see that as a responsibility being a medical practitioner in the state, and I would like to be able to raise the level of health for our whole state in general. And so, the idea is to slowly and steadily help areas like Triad and Triangle and further towards the east, and provide the same premium mobile experience every time they see any member of personalized physical therapy team.
So it's just making those connections with other practitioners throughout. But do you guys, with you and your wife, do you have to grow that business? Are you guys expanding? Are you taking on new people? Like how do you plan on growing that besides just making the connections with other practitioners like myself or others in the area?
Sure. So knowing that the way, again, how the name is set up, personalized physical therapy and wellness, the side that we are currently hiring is massage therapists and dietitians. And so what we want to provide is the holistic view of health to someone who has issues. And we know that there are need for respective cases, as well as when we are seeing the patients, we are in tune with their bodies much closer than them just walking into a massage practice and saying, well, why don't you just, get me my trapeze released or my right hip released, just from the patient perspective, what's going on, but also after, going through the rigor of evaluation that we spend an hour and a half figuring out what areas are having the issues, that we can give them feedback to the massage therapist that they would otherwise be going to. So we are currently working with other massage therapists, dietitians, chiropractors, acupuncturists in general, to allow them to understand wherever they're going, what their issues are and how they can modify for the patient's need. My vision, Farheen's vision, is to be able to provide all of that within our practice, where they can have the whole holistic approach and have this evaluation come in from a personal trainer perspective, from a massage therapist perspective, having a gym set up of classes. All of those is what we intended to go down towards the path of for the state of North Carolina.
That's great.
It's awesome. Yeah.
And how about other conditions that, I know you're kind of like the triad back expert, but you see other musculoskeletal complaints quite often, right?
Absolutely. Yeah. Well, interestingly, pelvis is also the areas around pelvis and the muscles has been known as the powerhouse of the body. And that's where all of this is coming down to, like the core and the central areas of the body. And so it's like the slings. There are slings going up into the upper back area and the front area, and the slings going down into the legs. And so there's a lot of correlations that happen, and that there's a lot of information traveling from the legs, from the upper body. And lower back is supposedly the most vulnerable area that bothers. However, but it also is one of the strongest areas of the body if it is kept and well maintained and taken care of. So there's a dilemma in the area, is to just keep strengthening, or be also allow other areas to be influenced. And so, yeah, we will make sure that whatever the condition is evolving from. If it is a shoulder in itself causing issues, then obviously we'll address that. And, knee causing the lower back issue, or the leg length discrepancy, or their feet, or the shoes that they would wear. And, accordingly, what I'm learning is the more I'm able to create transparency for the patient about their own body to their knowledge, that where they stand, what it is, what side of the body is stronger, weaker versus the other, the impairments, I'm able to help them so much better, and they see better outcomes. And so accordingly, we've started working on creating these in writings. And so I'm also writing a book on back pain to allow them to be able to continue to work on learning more about themselves and helping themselves much more streamlined than otherwise.
Yeah, you hit on some things there. Brian and I were doing a series of podcasts on prostate health, men and prostate health, and you were talking about that whole pelvic girdle and function there, and it's very interesting to me. There's some research out there that says that part of the issue is, as you were hitting on before, is that a lot of us were sitting like 8 to 13 hours a day, which certainly doesn't do anything positive for your prostate health. And it just makes me think, like, not only women, but men should really think about pelvic floor dysfunction too, and how all the blood vessels and lymph flow comes through that area and can be really congested if you're not moving that girdle or that core. And it seems to be affecting your prostate, which most men, at least most Western men, have an issue with, whether it's BPH. 1 in 6 men can get prostate cancer and stuff like that. So these are muscles that we don't ever think about, and that I think if we did, we could prevent a lot of the misery that comes along with that.
That's true, and that's something of a finding that I'm just learning from you. So thanks for sharing that knowledge. That is actually so true. Yeah.
Yeah, it's kind of crazy, because I think I don't think us men should be relegated to you're just getting, the older you get, you're just going to have prostate issues. I don't think that's necessarily true if you take care of your pelvic floor and all that. And, wellness is in a whole, eating better, making sure you're moving and stuff like that. So, anything else that we should talk about as far as like general complaints? Any new knowledge as far as like tennis elbow? I have a lot of patients with chronic shoulder issues. I mean, I think a lot of it has to do with this COVID stuff, like bent over a computer all day and doing, any other comments on that?
I would say I would be more than happy to send them our workshops that we do. And we've actually done the recent workshop, that virtual.
Oh, that's cool. Okay.
That we've done is on tennis elbow and round. We basically break down the nitty-gritty of the tennis elbow and rotator cuff, and break down the anatomy down to the actual tissue that bothers, and then come from inside out as to what steps they need to be taking to help themselves. And basically that can be something that they learn in the presence and comfort of their own home. So we do virtual workshops almost every month, once a month.
Oh, that's
and
cool.
We sit down and do some Q&As for whoever has questions about any of the conditions that they may have questions on our Facebook page, or just the patients that they would have asked questions. So one of the latest ones that is coming up, which is this Friday at 6 o'clock, we'll just sit down and do some Q&As, and we open it up live for the patients and just allow them to come on in and ask whatever questions that they have, and we're answering them. Come about. We usually have a topic that we're on, and that was, as I mentioned, about tennis elbow and rotator cuff. When we've talked about tennis in itself, because COVID-19 times, tennis is probably the most involved activity right now that everyone's allowed to do and is doing. So we've done a just breakdown of tennis workshops. So specific before tennis drills, on-court drills, and post-tennis drills. So we've done that, and we'll do once a month. We usually do it in the middle of the month, and I can certainly send you more information when it's. And then these are free. It's not like it's a paid workshop or something. It's just full of knowledge, and that's what we want to do is educate more people so we can raise the health of the community.
So they just go to your website. They could find all this information out, right?
Correct,
That's great. Yeah. That's really cool. Yeah, I've been taking up tennis for the last few weeks myself, and what I find is I have to go out there once a week because my elbow starts bothering me if I do go more than that. And it's I love being out there because I get to run around and everything. I'm the worst tennis player in the world, so I'm glad my partner is very patient with me. But we look ridiculous out there. But it's fun. It's a lot of fun. But I must be hitting the ball wrong because I'm getting that lateral epicondylitis going on. But anyway, that's great to know. That's good information to have. I'll definitely be referring my patients to that.
That's okay. I guess the internet was in and out. I was going to say, having a wall is also a very good friend. So maybe if you want to go out in front of the wall and just allow your arm to get used to. It's not going to scream. It's not going to yell. And you can express yourself in front of a wall.
Right. Right. Yeah. As long as I don't hit it over the wall every time I have to run around the wall to go get it. But yes. No, I need to do that. Absolutely.
Can you tell us a little about your podcast?
Oh yeah, absolutely. Yeah.
Yeah. Okay. Yeah. So basically the podcast was in the midst of COVID-19. Again, the idea behind the podcast, I have been in business practice for about 2 years now. And 2 years in, what I have learned about what wellness and what health services that are available in the area that I live in right now. I have learned so much more in 2 years than I ever did in the time that I've started living from 2014 until 2019. So 4 years of time, I didn't really get involved or knew or found information that was available, and everyone was out there providing, but then when I went out and started seeking for all the health and wellness services that are available for the community, I started to learn about them. And so as a practitioner, someone who's doing this day in, day out, has so much of struggle or not have the information come to them so easily that he's having to go out and look for what's available and what's not. I'm sure the community having a significant amount of, they know what type of services they can get benefit for. So that the podcast is to bridge the gap. The podcast is to bridge the gap between the practitioners that are out there and the people who are out there. And there is a available service, and then there is an available need, but there's not enough connection between the local communities. And so COVID-19 basically gave me the idea of bringing that together, and we basically bring the practitioner online and allow them to tell their story, what the services do they offer, what kind of vision do they have for the community, and a nice offer that they can get that they can offer to the listeners of the podcast so they can interact with the prospective client or the practitioner.
That's awesome. So you're no longer having to go into Google and type in a practitioner. You got all of their stories and all their information from some of the best places to get information right there. And what was the title of it?
It's called Healthy, Wealthy, Winston-Salem.
Healthy, Wealthy, Winston-Salem. That's awesome.
And they can find that again, I'm sure, on your website.
Correct. Yeah, they can go to the podcasts and they have that information over there. Yep. We'd love to have you on, Dr. Keoni and Brian, on the podcast.
Yeah, definitely. Would love to do that. I would do that. Let's set it up.
Throw your 2 cents, 2 nuggets on the podcast.
Okay. You hit on something about the podcast. Like, one of the reasons why Brian and I started this podcast was really just for, making connections out in the community and on the internet space and all that. But also, it's been wonderful for self-education. I mean, I think, I feel like I went through, you may laugh at this, Brian, but I feel like I kind of went through PT school with you to some extent,
Yeah.
So anyway, it's great. And then talking to all the experts out there. So yeah, I think the podcast is really not only a huge benefit for the community, but definitely for us to stay on top of things and the latest and greatest stuff. So it's really cool that you're doing that.
I was going to say, as a listener, I look at it as the Brian Keoni University that I log on to. Tuning into information.
Okay. That's great. Thank you. That's a hell of a compliment coming from you, Dr. Pathan. Thank you.
Absolutely.
Anything else we should talk about?
Yeah,
thank you.
I will say we are doing a televel evaluation offer. That includes basically an evaluation for anyone who's got any issues. We do the reporting of the condition. We do a virtual observation finding, and we break it down and create the home exercise program for them, and they get 24/7 access to us, which is about a $350 value, which is we're doing it just for the COVID-19 times and these unusual times for $49. So if anyone is looking forward to having own their health back and find out what their cause is, they can certainly hop on a call with us, and we are more than happy to take care of them.
We have a link for all your stuff, right? When we post this podcast, we'll put that out there then. You have
Correct,
a link?
correct.
Okay.
Yes.
If you can, I don't know if I have that, but if you can send us like whatever links we have to those programs and to your podcast and stuff, we'll put it on there when we post this, which will probably be in about a couple weeks? 2 or 3 weeks. Okay.
Sounds good.
Well,
yep.
All right. Well, Dr. Pathan, thank you so much for being on. I love your expertise. Thanks for always be willing to come on. Give your wife our love. I mean, she's been a superhero for a lot of our patients as well as you. So thanks again for what you do in the community, and we'll be in touch soon.
Yeah. And thank you for being an example for me.
Congratulations again, Brian, for being the Dr. Brosy.
Well, thank you. And thank you for setting such a great example for new grads like me. I can see the path when I can see the ship a little further down there. That's you. And that's exciting for me. So thank you.
I'm humbled. Thank you.
You guys have a good weekend. I'll see you soon.
Bye.
All right.